How I look at it. How I look at it is that we always talk in segments. We always see a patient in probably a cross section. Somebody has said that spirometry is gold standard. Somebody has said that 12% is the cutoff, 10% is the cutoff, or 14% is the cutoff. Somebody has said 200 ml, 150 ml, whatsoever the figures are, right? But my question is that who is making these guidelines? How these guidelines are made? We need to really understand. What is this 50th centile? What is this lower limit of normal? So do we need to go so categorical in all these numbers? Or we need to really apply our brain to a particular patient, to a particular child on the bedside? So this is more important, that we need to be combining everything together. Guidelines are there to give us a guide. That's why they are called as guidelines. They are not the rules. They are not the thing that we have to, you can say, like really follow each and every time, and otherwise you will be jailed and you will be sentenced and you will be doing like that. So what I want to say, for an example, if a patient who is coming to you, any child who is coming to you, and at that time if this child is coming with a good history, which you understand that this seems to be some sort of reactive airway disease, nighttime cough which is happening, seasonal variation which is happening, family history of allergy or asthma is there, past history of nebulization is there, so typical history, right? You performed spirometry, Doc Saab has beautifully elaborated all those spirometry, and you got a reversibility of 9%. Everything is fitting. Everything is fitting. You got a reversibility of 9%. Would you like to label this child as asthma or not? Simple question. Yes or no? Why? It is not fitting in the diagnosis. As per the guideline, it has to be 10%. As per the GINA guideline, it has to be 12%. Why? You are making a crime. 9% reversibility. Are you getting me? On the other hand, there is another person. Myself, I am standing in front of you. I do not have any symptoms right now. You perform my spirometry. My quality of life is good. Everything is good. I do not have any coughing. I do not have any breathing difficulty. Right? I do not have any, you can say, like breathing difficulty while walking or moving upstairs. Perfectly okay sleep. No other problems. Right? I do not have any problem. And you perform my spirometry. My reversibility came out to be 12%. You just label me as asthma. You start me your inhalers. You understood what I'm saying? So what I'm saying is that all these investigations, everything, they are the pieces of a puzzle. The puzzle is a big thing. You need to combine everything together and then see what is happening. For an example, in a given school, there are 100 children in a given class. 5th class, 100 children are there. You see the height of the children. And that height of the children is like a variation. That height of the children for a 5th class standard school student, that is around 10-year-old student or 10-year-old child, somewhere around 130 centimeter, 135 centimeter. So the middle point, the 50th child, could be having 135 centimeter. But the smallest child could be 125 centimeter. And the tallest child could be 140 centimeter. Now, with this first child till the 100th child, that is the first centile till the 100th centile, all are normal. You are not labeling anyone abnormal, correct? But you need some standard to compare against, and that is why you are taking the middle one, that is the 50th one, which madam was saying 50th centile, the middle one. That is 135 centimeter, you are taking it. Do you want to say that 49th centile or the 51st centile was abnormal? No, it is not that. For the easy calculation, you have taken the midpoint, that's all. Now, you want to take a range. Now, in this range, 50th centile with 95%, that is 2 standard deviation. You are taking these 2 standard deviations. That means 3rd centile and 97th centile. So, the 3rd centile became your lower limit of normal, LLN. And the 97th centile became your higher limit of normal or upper limit of normal. So, it all depends upon that what you want to see. If you want to see short stature, so short stature definition, you would like to see lower limit of normal. That means 3rd centile. If you want to see hypertension is high blood pressure, you will go for the 97 centile, that is upper limit of normal. Obesity, upper limit of normal. So do not ratta anything. It is only a basic science, it is only a common understanding that why you are talking about 50th centile, why you are talking about lower limit of normal, why you are talking about upper limit of normal. Okay, so do not mug up anything. Similarly, take the history, very good history, and after that interpretation, and then apply to the patient, whether it is applying or not. The other important thing is that one-time investigation do not have any value. Take an action, repeat after some time, could be 4 weeks, 6 weeks, whatsoever the time duration is required, and then see whatsoever action you have taken, whether it was appropriate or not. Okay, so that's how any test, whether it is a spirometry or any other particular test, any particular test will have value if you are combining it with the history. If you are not combining it with the history, it will not have any value at all. Standalone, it do not have any value. So with this, I will stop here, and now we will come to the another topic, which is oscillometry.